Question 1. A patient is admitted with diarrhea and dehydration due to an acute infection of enteropathogenic Escherichia coli. What is the correct ICD-10 CM code for this condition? A 043, B a 043, K52-9, C K52-9, A043, D a 043, E86-0. Answer D a 043, E86-0. This question tests your ability to code for an acute intestinal infection with a manifestation. The keyword due to indicates a direct causal link between the E. coli infection and the diarrhea, making a 043 enteropathogenic Escherichia coli infection the primary diagnosis. Dehydration is a common manifestation of severe diarrhea, requiring an additional code E86-0 for dehydration, as per ICD-10 CM coding guidelines for manifestations. Remember to always look for additional conditions that complicate the primary diagnosis, especially when specified as a manifestation or complication. Question 2. A patient presents with HIV disease and Kaposi's sarcoma. What are the correct ICD-10 CM codes? I. B20, C46, 0. B. C46, 0, B20. C. B20. D. C46, 0. Answer I. B20, C46, 0. This question focuses on the specific coding guidelines for human immunodeficiency virus, HIV, disease. The key rule for HIV is that when a patient is documented with HIV disease and develops an HIV-related condition, such as Kaposi's sarcoma and HIV-associated malignancy, the code B20 for HIV disease is always sequenced first, followed by codes for the HIV-related conditions. This guideline emphasizes the underlying systemic nature of HIV when active disease is present. Always remember that B20 takes precedence over the associated conditions when the patient has documented HIV disease. Question 3. A 60-year-old male is diagnosed with sepsis due to Pseudomonas infection. The physician also documented acute renal failure as a manifestation of the sepsis. What are the correct codes? I. R65, 20 and 17, 9. B96, 5. B. A 41, 50 and 17, 9. C. A 41, 50 and 17, 9. B96, 5. D. A 41, 50. Answer C. A 41, 50 and 17, 9. B96, 5. This question requires applying the sepsis coding guidelines, particularly for severe sepsis with an associated organ dysfunction. The keyword due to Pseudomonas infection indicates a 41, 50 sepsis due to other gram-negative organisms as the primary sepsis code. The phrase acute renal failure as a manifestation of the sepsis means that the acute renal failure and 17-9 is a direct consequence and should be coded as a secondary diagnosis. Additionally, the organism Pseudomonas is identified, necessitating an additional code from category B95, B97 to identify the infectious agent, in this case, B96, 5 for Pseudomonas. Remember to always identify the organism and any associated organ dysfunctions when coding sepsis. Question 4. A patient has a confirmed case of COVID-19 with pneumonia. How should this be coded? I. J12, 89 U071. B. U071, J12, 89. C. U071. D. J12, 89. Answer B. U071, J12, 89. This question tests the specific coding guidelines for COVID-19 with a respiratory manifestation. The guideline states that for confirmed COVID-19, code U071, COVID-19, is sequenced first, followed by codes for the associated manifestations. Since pneumonia is a manifestation, J12, 89, other viral pneumonia is coded second. This specific sequencing ensures that the primary diagnosis of COVID-19 is clearly identified, with its direct impact on the lungs. Always prioritize U071 as the principal diagnosis when COVID-19 is confirmed and is the reason for the encounter. Question 5. A patient is diagnosed with candidiasis of the skin and nails. Which code accurately represents this condition? I. B37-2. B. B37-81. C. B37-9. D. B37-0. Answer B. B37-81. This question requires you to select the most specific code for a fungal infection. The keyword candidiasis of the skin and nails directs you to the B37 category for candidiasis. Within this category, B3781 specifically codes for candidal onychomycosis, which means candidiasis of the nail and other candidiasis of skin. It is crucial to select the most precise code available rather than a general or unspecified code when the documentation provides sufficient detail. Always strive for the highest level of specificity when coding, as this accurately reflects the patient's condition. Question 6. A patient is admitted with acute viral hepatitis B with delta agent and hepatic coma. What is the correct coding sequence? I. B16-0. B. B16-0. K72-91. C. B16-0. K72-00. D. B16-0. K72-00. K72-91. Answer C. B16-0. K72-00. This question assesses your knowledge of coding for viral hepatitis, specifically with a delta agent and associated manifestations. The key information is acute viral hepatitis B with delta agent, which leads to the combination code B16-0, acute hepatitis B with delta agent with hepatic coma. Hepatic coma is a severe manifestation of liver failure, and K72-00, hepatic coma, not elsewhere classified without coma, should be added as a secondary code. Always look for specific combination codes that capture both the infection and its severe manifestations when available, and then add codes for further specific details if necessary. Question 7. A patient has a history of poliomyelitis and presents with post-polio syndrome. What is the correct ICD-10-CM code? I. G14. B. B91. C. 89. D. B91. G14. Answer D. B91. G14. This question tests the coding of sequelae, specifically for poliomyelitis. The keyword post-polio syndrome indicates that this is a late effect or sequela of a past poliomyelitis infection. For sequelae, the general guideline is to code the sequela, the residual condition, first, followed by the sequela code, which identifies the cause of the sequela. Therefore, G14 for post-polio syndrome is coded first, and B91 for sequelae of poliomyelitis is coded second to indicate the original cause. Remember the sequela first, cause second rule for coding sequelae. Question 8. Which of the following is the correct code for human papillomavirus, HPV, infection? I. B079. B. B97-7. C. B078. D. A63-8. Answer B. B97-7. This question assesses your ability to locate the specific code for human papillomavirus, HPV, infection in the absence of current disease manifestations. The keyword human papillomavirus, HPV, infection refers to the virus itself. In ICD-10-CM, B97-7 is the correct code for papillomavirus as the cause of diseases classified elsewhere, or for HPV infection without specific manifestations being coded. Remember that codes in B95, B97 are used to identify infectious agents in conditions classified elsewhere, or when the agent itself is the focus of the diagnosis. Question 9. A patient is diagnosed with primary congenital toxoplasmosis. What is the appropriate ICD-10-CM code? I. P37-1. B. B58-9. C. B58-0. D. B58-1. Answer I. P37-1. This question tests your understanding of coding for congenital infections versus acquired infections. The keyword congenital is crucial here, indicating that the condition was present at birth. While B58-0, B58-9 are for acquired toxoplasmosis, primary congenital toxoplasmosis is specifically coded under the perinatal conditions chapter, P37-1. This distinction is vital because congenital conditions have specific codes reflecting their origin in the perinatal period. Always pay close attention to whether a condition is described as congenital or acquired, as this dictates the correct chapter and code selection. Question 10. A patient is admitted for treatment of methicillin-susceptible Staphylococcus aureus, MSA, pneumonia. What is the correct code? I. J15-211. B. J15-212. C. B95-61. D. J15-20. Answer I. J15-211. This question requires specific coding for bacterial pneumonia, including the susceptibility of the causative organism. The keywords methicillin-susceptible Staphylococcus aureus, MSA, pneumonia point to a specific bacterial pneumonia. J15-211 is the combination code for pneumonia due to methicillin-susceptible Staphylococcus aureus. It is essential to choose the code that identifies both the type of pneumonia and the specific causative organism, especially when its susceptibility is specified. Always be as specific as possible regarding the organism and its resistance or susceptibility when coding infections. Question 11. A child presents with acute otitis media due to Streptococcus pneumoniae. What codes are assigned? I. H66, 90, B95, 3. B. H66, 00, B95, 3. C. H66, 00. D. H66, 90. Answer B. H66, 00, B95, 3. This question involves coding an infection with a specified causative organism. The keywords acute otitis media due to Streptococcus pneumoniae indicate that the specific type of otitis media and its bacterial cause are known. H66-00 codes for acute suppurative otitis media, unspecified ear. While there isn't a combination code for this specific condition and organism, ICD 10cm guidelines direct us to use an additional code from B95, B97 to identify the infectious agent. So B95, 3 for Streptococcus pneumoniae is also assigned. Always use an additional code for the infectious agent when it's identified and a specific combination code isn't available. Question 12. A patient is diagnosed with chronic viral hepatitis C with cirrhosis. What are the appropriate codes? I. B18-2, K74-60. B. B18-2. C. B18-2, K74-60. Z79-899. D. K74-60, B18-2. Answer I. B18-2, K74-60. This question involves coding chronic viral hepatitis with a liver manifestation. The keywords chronic viral hepatitis C with cirrhosis signify a specific type of hepatitis and its severe complication. B18-2 is the combination code for chronic viral hepatitis C. Cirrhosis, in this context, is a direct manifestation of the chronic hepatitis. K74-60, unspecified cirrhosis of liver, should be coded as a secondary diagnosis to provide additional detail about the extent of liver damage. For chronic conditions with manifestations, code the chronic condition first, then the manifestation. Question 13. Which of the following codes would be used to report active tuberculosis of the lung, confirmed by sputum culture? I. A 15-0. B. A 15-1. C. A 16-0. D. A 16-2. Answer I. A 15-0. This question tests your ability to select the specific code for pulmonary tuberculosis with bacteriological confirmation. The keywords active tuberculosis of the lung confirmed by sputum culture, are critical. A 15-0, tuberculosis of lung, confirmed by sputum microscopy with or without culture, specifically covers cases where the diagnosis is confirmed by bacteriological methods. It is important to distinguish between confirmed and unconfirmed cases, as well as the site of the tuberculosis, for accurate coding. Always look for confirmation status when coding tuberculosis. Question 14. A patient is seen for herpes simplex with ophthalmic manifestations. What is the correct ICD-10 CM code? I. B005. B. B008. C. B000. D. B009. Answer C. B000. This question asks for the specific code for herpes simplex with eye involvement. The keywords herpes simplex with ophthalmic manifestations indicate that the herpes simplex virus has affected the eye. B000, eczema herpeticum, refers to a skin manifestation, while B005 is for ophthalmic herpes simplex. Specifically, B005 is for herpes viral ophthalmic diseases. It's crucial to select the code that precisely matches the documented site of infection. Always choose the most specific code that reflects the anatomical site of the manifestation. Question 15. A patient has recurrent Clostridium difficile colitis. What is the appropriate ICD-10 CM code? I. A 047. B. A 0471. C. A 0472. D. A 0479. Answer C. A 0472. This question requires coding a specific type of bacterial intestinal infection with a recurring nature. The keywords recurrent Clostridium difficile colitis point to A047 for enterocolitis due to Clostridium difficile. Within this category, A0472 is specifically designated for recurrent Clostridium difficile colitis. It is important to note the recurrence, as this changes the specificity of the code. Always select the code that captures all documented aspects of the condition, including its acute, chronic, or recurrent nature. Question 16. A patient is diagnosed with dengue fever with hemorrhage. What is the correct code? I. A 90. B. A 91. C. A 97. 0. D. A 97-1. Answer B. A 91. This question tests your knowledge of specific arthropod-borne viral diseases. The keywords dengue fever with hemorrhage are key. A 90 is for dengue fever without warning signs, while a 91 is the combination code for dengue hemorrhagic fever. This specific code captures both the dengue infection and the presence of hemorrhage, which is a critical clinical finding. Always choose the combination code that fully describes the condition when such a code is available, rather than coding the condition separately. Question 17. A patient presents with acute HIV infection. What is the correct code? I. B20. B. Z21. C. B20 Z21. D. B20 R75. Answer I. B20. This question assesses your understanding of initial HIV coding. The keyword acute HIV infection indicates that the patient is currently experiencing the active disease stage, and not just asymptomatic HIV status or screening. According to ICD-10 CM guidelines, B20 human immunodeficiency virus, HIV disease, is used for all documented HIV infections, including acute infection. It signifies active disease and should be used regardless of the stage if HIV disease is present. Do not use Z21 asymptomatic HIV infection status when the patient is documented with active HIV disease or acute infection. Question 18. A patient is diagnosed with mumps orchitis. Which code is correct? I. B26 0. B. B26 8. C. B26 9. D. B26 81. Answer D. B26 81. This question requires specific coding for a viral infection with a particular manifestation. The keywords mumps or orchitis specify mumps with inflammation of the testes. While B26.8 captures other mumps complications, B26.81 is the more specific code for mumps or orchitis. It's important to find the most granular code that precisely describes both the infection and its specific organ involvement. Always aim for the highest level of specificity in your coding to accurately reflect the patient's condition. Question 19. What is the appropriate code for a patient with sepsis due to Escherichia coli with septic shock? A 4150 R65 21 B96 20. B. A 4150 R65 21 B96 21. C. A 4109 R65 21 B96 20. D. A 4150 R65 20 B96 21. Answer B. A 4150 R65 21 B96 21. This question involves coding severe sepsis with septic shock and a specified organism. The phrase sepsis due to Escherichia coli with septic shock dictates the use of a code for sepsis due to a specific gram-negative organism, A4150 for sepsis due to other gram-negative organisms, as E. coli is a gram-negative Rho-D. The presence of septic shock requires an additional code, R6521, severe sepsis with septic shock. Finally, B9621 for Escherichia coli, as the cause of diseases classified elsewhere, identifies the specific organism. Always remember the three components for severe sepsis with shock: the sepsis code, the severe sepsis with septic shock code, and the organism code. Question 20. A patient has a fever and rash, diagnosed as varicella without complication. What is the correct code? A. B010. B. B019. C. B018. D. B011. Answer B. B019. This question tests basic coding for a common childhood viral infection. The keywords varicella without complication indicate uncomplicated chickenpox. B019 is the correct code for varicella without complication. It's crucial to differentiate between complicated and uncomplicated cases, as separate codes exist for manifestations like encephalitis or pneumonia due to varicella. When no complications are specified, the without complication or unspecified code is appropriate. Question 21. A patient presents with cryptococcal meningitis. What is the correct ICD-10 CM code? A. B45-1. B. B45-9. C. G021. D. B45-0. Answer D. B45-0. This question requires specific coding for a fungal infection affecting the central nervous system. The term cryptococcal meningitis directly points to B45-0, cryptococcal meningitis, a specific code for this type of fungal infection in the meninges. It is important to find the most specific code that includes both the type of fungus and the anatomical site of infection when available. Always check for combination codes that capture both the infectious agent and the site of infection. Question 22. A patient is diagnosed with acquired immunodeficiency syndrome, AIDS, with pneumocystis carinii pneumonia. What are the correct codes? A. B20, B59, B. B59, B20, C. B20, D. B59. Answer I. B20, B59. This question again addresses HIV coding guidelines, specifically for AIDS with a defining opportunistic infection. The keywords acquired immunodeficiency syndrome, AIDS, and pneumocystis carinii pneumonia indicate an active HIV disease with an associated opportunistic infection. As per HIV coding guidelines, B20 human immunodeficiency virus HIV disease is always sequenced first, followed by the code for the opportunistic infection, which is B59 for pneumocystosis, Pneumocystis carinii pneumoniae. This consistent sequencing highlights the primary role of HIV in the patient's condition. Question 23. A patient is being treated for infectious mononucleosis with an acute exacerbation of hepatitis. What are the correct codes? I. B2790, B2799, B. B270, K739, C. B2790, K739, D. B270, K7290. Answer C. B2790, K739. This question involves coding an infectious disease with an acute manifestation. The keywords infectious mononucleosis with an acute exacerbation of hepatitis point to the primary diagnosis of infectious mononucleosis, which is B2790, infectious mononucleosis, unspecified. The acute exacerbation of hepatitis is a separate, although related, manifestation of the infection and is coded as K73-9, unspecified chronic hepatitis, not elsewhere classified, or, depending on specific documentation, an acute hepatitis code. When an infectious disease causes a separate, specific organ involvement not included in a combination code, both the infection and the manifestation are coded. Question 24. A patient is diagnosed with YAS. What is the correct ICD-10-CM code? I. A 66-9. B. A 66-0. C. A 66-1. D. A 66-8. Answer I. A 66-9. This question asks for the general code for the spirochetal disease YAS. The keyword YAS points directly to category A66, YAS. A 66-9, YAS unspecified, is the correct code when no specific manifestation or site of the disease is documented. It's important to be familiar with the main codes for less common but distinct infectious diseases. Always use the most general code available if no further detail is provided in the clinical documentation. Question 25. A patient is admitted with a urinary tract infection, UTI, due to enterococcus. What codes are assigned? I. N39-0, B95-2. B. N39-0. C. B95-2, N39-0. D. N39-0, B96-89. Answer I. N39-0. B95-2. This question tests your ability to code a common infection with a specified bacterial cause. The keywords urinary tract infection, UTI, due to enterococcus mean the primary condition is a UTI N39-0, urinary tract infection, site not specified E. Since the specific organism enterococcus is identified and there is no combination code for UTI due to enterococcus, an additional code from B95-B97 must be used to identify the infectious agent, which is B95-2 for enterococcus as the cause of diseases classified elsewhere. Always use an additional code to identify the organism when known and not part of a combination code. Question 26. A patient presents with impetigo due to streptococcus. What is the appropriate code? I. L0100, B95-0. B. L0100, B95-5. C. L0100. D. B95-0, L0100. Answer B. L0100, B95-5. This question involves coding a skin infection with a specific bacterial etiology. The keywords impetigo due to streptococcus indicate impetigo L0100, impetigo unspecified D caused by a streptococcal organism. Since L0100 is a general code for impetigo and does not specify the organism, an additional code from B95-B97 is required to identify the infectious agent. B95-5 is the code for unspecified streptococcus as the cause of diseases classified elsewhere. Remember to use an additional code for the organism if a combination code is not available and the organism is specified. Question 27. What is the correct code for a patient diagnosed with congenital syphilis? I. A 50, B. A 59, C. A 51, D. P37, Answer I. A 50. This question focuses on the specific coding for congenital forms of infectious diseases. The keyword congenital syphilis is essential. Unlike some other congenital infections coded in Chapter 16 AP codes, syphilis has specific codes within Chapter 1. A 50 is the correct code for early congenital syphilis, symptomatic. It is vital to recognize that some congenital conditions are found within the specific infectious disease chapters rather than solely in the perinatal chapter. Always refer to the index and tabular list for specific guidance on congenital infections. Question 28. A patient is diagnosed with Lyme disease with polyneuropathy. What is the correct coding? I. A 69, G63, B. A 69, C. A 69, G63, D. G63, A 69, Answer C. A 69, G63, This question tests the coding of an infectious disease with an associated neurological manifestation. The keywords Lyme disease with polyneuropathy point to a 69, Lyme disease unspecified, which encompasses various manifestations when not specified further. However, polyneuropathy is a specific neurological manifestation, and G63 polyneuropathy and infectious and parasitic diseases classified elsewhere should be added as a secondary code to provide full detail. Remember that an asterisk next to a code, like G63 indicates it's a manifestation code that should be sequenced second. Question 29. A patient is admitted with a diagnosis of West Nile encephalitis. What is the correct code? I. A 92, B. A 83, C. B00, D. A 85, Answer B. A 83, This question requires specific coding for a viral infection of the central nervous system. The keywords West Nile encephalitis clearly point to a 83, West Nile virus encephalitis. This is a specific combination code that identifies both the virus and the neurological manifestation, encephalitis. It is crucial to choose the most specific code that describes the etiology, the cause, and the affected body system. Always look for specific combination codes that capture both the virus and the disease it causes. Question 30. A patient presents with intestinal salmonellosis. What is the appropriate ICD-10 CM code? I. A 020, B. A 0220, C. A 029, D. A 021. Answer I. A 020. This question asks for the specific code for a common foodborne bacterial infection. The keyword intestinal salmonellosis refers to the infection of the intestines by Salmonella bacteria. A 020 is the precise code for Salmonella enteritis, which is the medical term for intestinal salmonellosis. It is important to know common medical terms and their corresponding ICD-10 CM codes for accurate reporting. Always aim for the most specific code that precisely describes the condition. Question 31. A patient is diagnosed with chronic giardiasis. Which code is correct? I. A 071, B. A 079, C. A 070, D. B60. Answer I. A 071. This question requires coding a specific protozoal intestinal infection. The keyword chronic giardiasis directly points to a 071 giardiasis lamblysis, which typically refers to the intestinal form. While A070 is for ballantidiasis and B60 for babesiosis, A071 is the appropriate code for giardiasis. It is important to know the specific codes for various parasitic infections, especially those that frequently affect the gastrointestinal tract. Question 32. A patient has bacterial meningitis due to an unspecified bacterium. What is the correct ICD-10 CM code? I. G009. B. G009. B99. C. G009. B96. 9. D. A49. 9. G009. Answer C. G009. B96. 9. This question involves coding an infection of the central nervous system with an unspecified bacterial cause. The keywords bacterial meningitis due to an unspecified bacterium indicate that G009, bacterial meningitis unspecified, is the primary diagnosis. Although the bacterium is unspecified, ICD-10 guidelines suggest using an additional code from B95, B97 to identify the infectious agent when known or to indicate bacterial etiology when the specific bacterium is not documented. Therefore, B96, 9, unspecified bacterial agent as the cause of diseases classified elsewhere, is used to confirm the bacterial nature of the infection. Always use the most specific organism code available, but use an unspecified organism code when only the general type of organism, e.g., bacterial, is known. Question 33. A patient is diagnosed with malaria, Plasmodium falciparum, with cerebral complications. What is the appropriate code? I. B58. B. B50. C. B59. D. B50. G050. Answer B. B50. This question asks for the specific code for a severe form of malaria with a critical manifestation. The keywords malaria, Plasmodium falciparum, with cerebral complications directly lead to B50, Plasmodium falciparum malaria with cerebral complications. This is a combination code that captures both the specific type of malaria and its severe neurological complication. It is vital to select the most specific code that encompasses both the infectious agent and its specific serious manifestations when such a combination code exists. Question 34. What is the correct code for a patient with herpes zoster, shingles, with encephalitis? I. B0222. B. B0220. C. B0229. D. B021. Answer I. B0222. This question requires specific coding for a viral infection with a neurological complication. The keywords herpes zoster, shingles, with encephalitis indicate that the varicella zoster virus has caused both shingles and brain inflammation. B0222 is the specific code for zoster encephalitis, which precisely describes this condition. It's crucial to identify the exact manifestation to ensure the highest level of specificity in coding. Always search for combination codes that directly link the infection to its neurological or other specified complications. Question 35. A patient has an unspecified infectious and parasitic disease. Which code is appropriate? I. B99. B. A099. C. R59. D. R69. Answer I. B99. This question tests your knowledge of general, unspecified codes within Chapter 1. The keywords unspecified infectious and parasitic disease directly point to B99, other and unspecified infectious diseases. This code is used when there is documentation of an infectious or parasitic disease, but not enough information to assign a more specific code from within Chapter 1. Remember to use B99 only when no further detail is available and the condition is clearly infectious, not just an ill-defined symptom.